Welcome viewers. I am Dr. Ganga Prasad, Assistant Professor, Department of Dermatology, Patliputra Medical College, Dhanbad. For the last few years, I have been seeing so many cases of fungal infection of the skin in our OPD and our dental practice. Actually, in previous years, we were not getting so many cases because many of the cases used to be treated at the periphery, and we didn't have opportunity to see so many cases. So we thought, what is the reason behind it? Reason behind it, many of the drugs which were effective in the study years is not nowadays so effective. 2 or 3 years back, we were treating all the cases with the fluconazole, which used to be available in our hospital, and with some topical agents. But nowadays they were not responding. So what is this condition, this fungal infection? Fungal infection, this is caused by dermatophytes, a particular variety of this fungus, dermatophytes, which affects the most superficial layer of the skin, that is stratum corneum. Not only stratum corneum, it can affect the other tissues like hairs and nails which have keratin. These dermatophytes, they thrive on keratin layer of the skin. Keratin layer is found in stratum corneum, hairs, nails. So they affect those organs. They eat away all the keratin over there. They extend outward. Since they are not very amenable to the treatment, they extend and they become very extensive. Lot of itching and everything is there. So we thought, what is the reason behind it? Why so many cases are coming to us? We analyzed that in periphery, most of the cases of fungal infection, they are treated with mixed preparations, like they combine this antifungal along with antibiotic, corticosteroid. Not only this mild corticosteroid, moderate or sometimes very most potent or potent corticosteroid are associated, are incorporated in it. And in our book of dermatology, Andrews, it says that application of corticosteroid, especially potent corticosteroid, can lead to local immunosuppression and can lead to widespread fungal infection. And that is the situation over here. None of the private practitioner or other specialty doctor, they are treating this fungal infection with only topical antifungal agent. They are using costlier antifungal systemic oral preparations, but they are not using the topical antifungal alone. That's why there is widespread infection. Sometimes this corticosteroid, it leads to tinea incognitio. It is known that when corticosteroid is applied, the morphology of the fungal infection is quite changed, and it becomes very difficult to treat. So what should we do to prevent this particular situation, which is not only rampant in our locality, it is rampant all over India. In many parts of the countries like Calcutta, Assam, Delhi, Kanpur, and even from Assam, Siliguri, patients are coming and they are not getting cured over there, and they are coming to us. So in those situations, what should we do? And that's why this video is that we should educate our patients, general public, that personal hygiene is important. This clothing should be regularly washed and laundered so that the fungus gets eradicated. Because when we treat fungal infection, when we don't treat it properly, the fungi, they turn into spores and they are over the skin for a long period of time. To eradicate those fungus, the washing and laundering of the clothes is very important. When we get cases, we should consult. When we get these fungal infection, we should consult our doctors, and doctors also should treat it with systemic and topical antifungal agents. Topicals mean local application of antifungals. Local preparation of antifungals, many of them imidazole group, they are clotrimazole, miconazole, iconazole, laliconazole. These are the preparations which is used commonly. Sometimes clotrimazole and miconazole and other antifungals were effective. Nowadays, the most effective one is laliconazole, which was available not very frequently, because the company which was manufacturing it, they were getting the raw materials from outside. Now everywhere it is available, and we are getting many preparations of laliconazole. Not only laliconazole, terbinafine and cyclopyroxolamine and this ketoconazole, etc. They are also very effective. So when treating fungal infection, we must be very particular that use it only topical antifungal. Don't mix it with anything. In previous teaching also, it was said that when the fungal infection is localized one, treat it with only with topical agent. You would apply it. Here the rule of 2 is important. You should apply twice a day over the affected part, 2 centimeters beyond the line of the margin of the fungal infection, and when it gets cured one, you should continue it for the next 2 weeks also. So topical preparation, anything we can choose. Regarding systemic preparations, in yesterday years, this chrysopulmin was very much effective. Since long it was being used, it was very effective. A few years back it was not available in the market, that's why we started treating with other preparations. Fluconazole remained the treatment of choice for many years, but when this fluconazole was not effective, then we started another preparations. In other preparations, many preparations came, and in those this itraconazole is supposed to be the most effective nowadays. Itraconazole, the dose in the book, it is only 200 milligram daily or 100 milligram twice daily for 7 days only. But when we gave our patients for 7 days therapy, many cases relapsed very frequently. So we continued it for 2 weeks. Even after 2 weeks, we were getting relapses. So nowadays we are treating it with 4 weeks therapy of itraconazole along with this antifungal agent. So this itraconazole is nowadays quite effective. Topicals, anything we can choose. Thank you, viewers.